Mass incarceration means that we've got a very high rate of incarceration historically, comparatively. And the other thing is the rate of incarceration is so high, so socially concentrated, that we're no longer incarcerating the individual, but we're incarcerating whole social groups. The rate of incarceration now is about 5 times higher than it was historically. Historically it was 100 per 100,000. Now it's about 500 per 100,000. If we look at prison, if we add jail to that, it's about 700 per 100,000. Nowhere in the world incarcerates as much as we do. We've seen extremely high rates of exposure to the criminal justice system for African American men with very low levels of schooling. So if we think about black men who were born in the late 1970s and who are growing up through the American prison boom of the 1980s and the 1990s, the chances that they're going to serve time in state or federal prison if they dropped out of high school is about 70%. So going to prison for that group of black men with very low levels of schooling, that's become a normal life event. And that's really only happened in the last 10 years. We're at this point now where there's about 1.2 million African American children with a parent who's incarcerated. And that's about 1 in 9. The research shows that kids who experience parental incarceration have diminished school achievement, they have behavioral problems, depressive symptoms, acting out, and there's also evidence that these kinds of negative effects associated with parental incarceration are concentrated more among boys than among girls. And there's a very real risk here that incarceration becomes an inherited trait. The underlying issue is we've chosen prison as a way to respond to that problem of crime. And there are a whole variety of ways that we could have chosen to respond to that problem of crime. We've chosen the response of the deprivation of liberty, and we've chosen the response of the deprivation of liberty for a historically aggrieved group whose liberty in the United States was never firmly established to begin with.
When it comes to incarceration, where you live makes all the difference. Take Maricopa County in Arizona and Miami-Dade County in Florida. These two counties have a lot in common. They have similar criminal justice laws, similar crime rates, and similar demographics, including a large immigrant population, but that's where the similarities end. Since 2000, Maricopa has increased the number of people it sends to prison by 33%. Over that same period, Miami-Dade has reduced the number of people it sends to prison by 46%. Today, Maricopa locks up twice as many people per capita in state prison as Miami-Dade does. While both counties have seen substantial reductions in crime, Miami-Dade did it without sending more people to prison, showing that crime reduction is possible without locking people up for expensive prison terms. Maricopa County, like Arizona, is falling behind the rest of the nation. While many other states and cities are implementing smart reforms to reduce crime and incarceration, Arizona is doubling down on the failed policies of the past. And at what cost? The state is spending $1 billion a year on a bloated prison system that is not making Arizonans safer. Arizona must fix its broken criminal justice system and revisit the outdated policies that hurt its economies, communities, and families.
As people of faith, our scriptures tell us that all life is sacred. As people of faith, our scriptures tell us each person deserves dignity. As people of faith, our scriptures tell us every person in this world deserves a chance for redemption, for forgiveness. As an interfaith network, our faiths tell us that the holy and holies, as understood in each of our faith traditions, is concerned with the well-being of all persons, and is merciful and forgiving. Our combined scriptures speak of a God as one who seeks to restore relationship and community, who is merciful, and who punishes in order to bring transformation and renewal, not revenge. As people of faith, we believe that the American prison industrial complex system is drenched in the sin of systemic racism and must be called to repentance. We believe that people and communities of color and the poor are unfairly and unjustly targeted by policing practices and prosecution that tears families and communities apart. We believe that in this global pandemic, our society is forgetting about people who are living in cages and is forgetting that these people are also deserving of fair access to healthcare and safety, as all people are, because all life is sacred. As people of faith, we believe that even though this problem is overwhelming, if we stand together, we can find an answer. And together, we can stand for justice. Together, standing in our diverse faiths, we can, we must, and we are required to demand better, to demand justice, to demand wholeness and reconciliation as our faiths tell us to. That is why, as people of faith and this Arizona community, today we gather together. Well, good afternoon, everybody. My name is Reverend Katie Sexton, and I am the Executive Director of the Arizona Faith Network, and it is a joy to be here together today discussing a very difficult topic. As we gather this morning, I just have a couple housekeeping tips before we start going to our speakers. One is we do have a question and answer section open that you should be able to find on the bottom of your Zoom. If you place your questions in there or in the chat during this time, we will attend to those as we go, as well as we will answer at the very end. It's also important to note that following this presentation at 1:30, we will have a time for small group discussions. There will be a separate link to get into those discussions with our speakers and with our Arizona Faith Network leadership and clergy. So please look in the chat for that, and we'll announce that at the end as well. Throughout our time together, you will see some polling questions pop up as well. That is to help direct our teams who are working on criminal justice reform. And so with that, I'd like to introduce our lead on criminal legal reform for the Arizona Faith Network, and that is Khalil Rashdan. And as he introduces our speakers, we invite you to introduce yourselves in the chat as well. Khalil.
Thank you, Katie. My name is Khalil Rashdan. I'm the Community Partnership Coordinator for the ACLU of Arizona's Campaign for Smart Justice, and I'm a directly impacted person by incarceration. I served 15 and a half years of a life sentence prior to my case being overturned due to prosecutorial misconduct and vindictiveness. So to be here today, I always refer to it as a blessing and being lucky. Had my case not been overturned, my parole date, which is in question now because the issues of parole are being addressed in this state, but my parole date would probably not have been till sometime in 2021. So I always refer to my case being overturned with the help of the Arizona Justice Project as a blessing and being lucky. In March of 2018, I joined the ACLU of Arizona's Campaign for Smart Justice, which is a multi-year national campaign to reduce our prison populations by 50% and combat systemic racism within the criminal legal system, which leads to the disproportionate prosecutions of poor communities and communities of color here in Arizona. I work towards prosecutorial accountability, the elimination of cash bail practices, and an increase in earned release credits for those confined. Arizona currently incarcerates about 42,000 people and is the fifth highest incarcerator in our nation. We spend about $1.1 billion a year, or 11% of the state's budget, just to house people in our prison. And the bottom line around that is Arizona sending too many people to prison. Now, in March of this year, the threat of COVID-19, coupled with the mass incarceration crisis in our state, is a deadly combination. And at the beginning of this global pandemic, the CDC issued strict guidelines to effectively stop the spread of COVID-19 and save life within the prison systems. The CDC recommendations were social distancing, 6 feet or more, wear masks, cloth to cover the mouth and nose, properly wash hands, clean and disinfect living areas. I myself have been in quarantine at home for several months now, and I'm trying to follow those recommendations the best of my ability due to the circumstances of being an advocate on the front line. However, while the general public can protect themselves by following these guidelines, those who are incarcerated cannot and are at the mercy of the Arizona Department of Corrections, Rehabilitation, and Reentry. At the beginning of this pandemic, the CDC evaluated the conditions of confinement, and as a result, the CDC issued a separate set of guidelines to decrease the spread of COVID-19 in carceral facilities and protect those behind bars. Some states across the U.S. listened to the CDC and started taking steps to protect their incarcerated populations, including reducing prison and jail populations. However, Arizona has done nothing, minimal to nothing. States like New Jersey, Kentucky, and Georgia have started releasing nonviolent, non-dangerous individuals, elderly people, people with pre-existing conditions who are extremely vulnerable to COVID-19, and all of those who were unnecessarily confined. Georgia Department of Corrections announced the consideration of clemency releases for nonviolent offenders who were within 180 days of completing their prison terms. However, it would make sense to look at all sentences for people who would be released anyway, or in the state of, or around the topic that we're going to discuss today, who are just unnecessarily confined, who are just sitting there being punished, okay? In response to the threat faced by incarcerated people, the ACLU and several other organizations have been a megaphone for the voices of those confined and family members who are concerned about the health of their loved ones in jails and prisons. While the community fights to save lives, some of our state officials, such as Governor Ducey, Corrections Director Shin, have elected to place public health and public safety at odds by refusing to release people. These officials have failed to follow the CDC guidelines or take into account the infection rates and deaths in other states, and in our federal prison system. This lack of leadership sometimes creates hotspots of infections within the Arizona prison system, with serious COVID-19 outbreaks occurring in Florence and in Yuma prison complexes. And that's both staff and those individuals who are confined. According to the Arizona Department of Corrections and Rehabilitation, there are now 705 confirmed cases of COVID-19. However, they've only tested roughly about 15 to 20% of the prison population statewide. It is safe to assume that COVID-19 spread is more severe than what's being reported. Today's discussion will explore concerns around issues of public health and public safety and how we can work together, but then also the notion of compassion and how we define justice as a community. How that word justice does not mean punishment. It does not mean retribution. It does not mean confinement. But the challenge moving forward is to get people to redefine that and have mercy, have understanding, have forgiveness, but then also compassion. So now I would like to introduce our first speaker, a good friend of mine, Katie Posauskas. And that conversation will be about compassion. Katie, welcome.
Thank you, Khalil. Thank you, Katie, and to the Arizona Faith Network and to the ACLU and everybody who put on this program. It is very important to talk about compassionate release procedures for prisoners generally when we're not in the midst of a pandemic, but of course it's even more important now that we're being faced with COVID-19, and we're looking at how we can safely release prisoners from incarceration under the circumstances. So just to give sort of a very brief sort of backdrop to put sort of Arizona into context within this whole thing, and then to sort of put our prison population into context. And then I'm going to talk about what are the procedures that are in existence right now in Arizona for a prisoner to seek release for a medical condition, or if they're terminally ill, if they catch COVID-19, what are those procedures? What do they look like? And how do we in Arizona compare with other states across the country? And then what can we do in Arizona to sort of improve those processes and procedures, because there is a lot of improvement that needs to take place here. And there's a lot that the Arizona Justice Project has been working on. Sort of worldwide, these are the numbers from this morning. We have 16.3 million confirmed cases of COVID-19, 649,000 deaths. This is among 188 counties and regions. In the United States, we have 4.2 million confirmed cases, 147,000 deaths. The United States continues to be the highest individual country with the highest number of infections and deaths from COVID-19. According to the Arizona Department of Health Services, in Arizona, we have 162,000 confirmed cases, 3,300 deaths, and just over 1 million people tested. The confirmed cases is probably much lower than what is actually out there, because people who have it may not be getting tested, or they may be asymptomatic and they don't know that they have it. The Marshall Project in New York publishes the number of prisoners across the country and by state who've been infected. And as of July 23rd, they are reporting just over 70,000 prisoners across the country, which is an astonishing number. 713 deaths. Over 15,000 cases amongst staff people, and 54 deaths amongst staff. The Arizona Department of Corrections on their website publishes the number of COVID cases that they have. I do not know how recently this information is being updated. I got this information this morning. And for those of you who don't know, Arizona is the 4th highest incarcerator in the country. We have just over 40,000 people incarcerated in our prisons across the state, and we have another 5,000 people on community supervision or parole who are being supervised. As of this morning, just a little over 5,000 prisoners had actually been tested. We have 705 confirmed cases. We have 5 deaths confirmed, 8 deaths pending confirmation. As is the case, everywhere, those numbers are probably higher than what is being reported. There are 350 tests that are still pending, so we don't know what those show. And there's been only a little over 5,000 prisoners tested out of 40,000 people. The prisons with the highest rate of infection, I know Khalil touched on this, but we're seeing the highest rates of infection in Tucson, Yuma, Florence, Phoenix, and Lewis. Tucson and Florence both have an infirmary. One of my clients who we're going to be talking about today is actually in the infirmary at Central Unit in Florence. And I know they've been seeing sort of a high number of cases there. So obviously we know it's here, right? We know it's here, it's in the Arizona prisons. What can we do to prevent the spread, to treat people who have it, treat them appropriately? And what can we do to look at release procedures for people, especially those who are the most vulnerable, who have medical conditions, who are most susceptible to infection? What can we do to safely release those people? In Arizona right now, there are some procedures to do that. There aren't very many, and the effectiveness is in question. So one of those procedures is compassionate leave through the Arizona Department of Corrections. Compassionate leave is not available to everyone. You have to be eligible to seek compassionate leave. It is a temporary measure, so it's a temporary release from the Department of Corrections. It's not permanent. The purpose of it is to obtain medical treatment. The decisions are made by the director of the Department of Corrections. It is at the discretion of the director. In order to make that request, you can send a request to central office. There is a policy, and you can ask if you're eligible to seek compassionate leave, and you can give your reasons why you think you should receive one. We have tried this procedure recently with a client of ours. His name is Ramon Stewart, who we will be talking about today. You will actually hear from Ramon's mother, Aurelia, who is supposed to call in. We have tried this procedure with Ramon, tried it twice. We've been denied both times. And Ramon's case is one of the most egregious we've ever seen. So if Ramon can't obtain compassionate leave, I really don't know who is. I have not heard of anybody receiving compassionate leave for purposes of COVID-19. There may be some that we don't know about. I just have not heard of any amongst the colleagues that we work with. Another avenue of release is through clemency, through the clemency procedure. In Arizona, clemency is an executive function. The governor has the ultimate decision. In order to get a recommendation to the governor, somebody has to first go through the Arizona Board of Executive Clemency. Not everyone is eligible to apply for clemency. Your sentence controls whether you're eligible. So individuals with flat time, so if an individual is serving, let's say 22 calendar years, they are not eligible to seek release on any basis until every single day has been served. So that includes commutation or clemency. So very unfortunately, not everyone is eligible to apply for clemency. Those who are eligible to apply If the prisoner is within 4 months of death, they can seek commutation based on imminent danger of death, which means that they get to skip a phase 1 hearing and go directly to a phase 2 hearing. Clemency in general is extremely, extremely difficult to receive here in Arizona. But for those who apply under the imminent danger of death exception, those individuals, we've seen those individuals being granted more frequently than the general population. But if a Department of Corrections doctor does not confirm the prognosis of death within 4 months, then an individual will have to apply under the general commutation policy, which means they have to go through a phase 1 hearing and a phase 2 hearing. Then they have to get a recommendation. That recommendation goes to the governor's office. If it's a unanimous recommendation, the governor has 90 days. If the crime was committed on January 1, 1994, or to the present, if it was before January 1, 1994, the governor can sit on that recommendation for as long as he or she would like. If it is not a unanimous recommendation, the governor can sit on that indefinitely. And so Arizona probably has the narrowest policy when it comes to clemency based on imminent danger of death in the country. It's narrow because, like I mentioned, clemency is not open to everyone. And number 2, you have to be within 4 months of death. And so what about somebody who is not within 4 months of death, but who is incapacitated? Or somebody who catches COVID-19 and has other serious medical conditions, but the prognosis may not be within 4 months. Those people will not be heard under the imminent danger of death exception. So our policy in Arizona is extremely, extremely limited. We have done research on what other states are doing and what their policies and procedures are. We have drafted a model bill for medical parole for here in Arizona that we really, really hope that the legislature will seriously consider next session, because it is a problem here in Arizona. The other way to seek release is, a possible negotiation with the county attorney's office. Those are extremely rare. They can occur given the circumstances, and we should never discount those. Working with the county attorney's office to let them know what the situation is to try to resolve the issue. That is another option. There are 3 county attorney's offices that I know of that have conviction integrity units, and that's Pima County has a conviction integrity unit. Pinal County has a review committee there. And I just learned last week of a prosecution integrity unit at the Maricopa County Attorney's Office that is has just opened apparently. And we have not sent any cases there, but we are planning to send one to them. So that is an option. Again, it's very rare with all of these procedures. They're very, very, as far as if release will be granted, it's very rare. Lastly, a prisoner can file a petition for post-conviction relief under Arizona's post-conviction rules and statutes. Again, there are limitations there with regard to what claims can be brought and whether you'll be precluded and what the case law says and all of that. But it is an option to sort of look at. So briefly, how am I doing on time? I was going to talk a little bit about Ramon Stewart's case. Okay, so I wanted to talk about a case that we are currently working on. I had mentioned this prisoner's name is Ramon Stewart. He's incarcerated at ASPC Florence in Central Unit. He's in the infirmary there. He is 32 years old, and he very unfortunately suffers from primary progressive multiple sclerosis, which is the most severe and the most rare form of MS that you could have. Ramon was actually diagnosed at the age of 21, just after his sentencing hearing. His form of MS has progressed extremely rapidly to where he is now, he's completely bedridden. He's completely incapacitated. He is at the complete mercy of prison staff and health officials for every need that he has. Bathing, eating, being turned over. He is somebody who could not protect himself against COVID-19 in any way. He cannot put on a mask. He can't take a mask off and on. He can't walk out of a room if somebody's coughing or sneezing. He can't wash his hands. He can't bathe himself. He could do nothing to protect himself against infection. When COVID-19 sort of hit the prisons and we saw what was going on there very early on, we requested compassionate leave for Mr. Stewart through the Arizona Department of Corrections. Our request was denied by the director of the Department of Corrections. 3 or 4 days after it was denied, Mr. Stewart was rushed to the hospital with possible aspiration, possible stroke. He was tested there for COVID-19, and the next day he tested positive. He was sent back to the infirmary in Florence, where for months he suffered from, all of his complications with the MS. On top of that, complications with COVID-19. We were informed that he was in imminent danger of death. So we resubmitted the request for compassionate leave. Through DOC, there is a nursing home that had agreed to take him. And unfortunately, our request was denied again. It looks like, as of today, that Ramon either is totally recovered or is on his way to total recovery from COVID-19, which is absolutely remarkable. This man's will to live is just absolutely incredible. But did he have to suffer in there for all of that time, while he was going through this? And is he susceptible to reinfection? That is something that we just don't know. And even without the pandemic and even without the COVID-19 symptoms and diagnosis and all of that, we believe that Ramon should be able to be released safely into the community. He would go directly from the Arizona Department of Corrections, where he is bedridden, he cannot move, and he would go to a nursing facility where he would not leave. At that nursing facility, he would have access to multiple sclerosis specialists who could treat him properly and appropriately under the circumstances. And he would have access to his family members who can advocate for him, because right now he does not have an advocate in the prison who can fully communicate what his symptoms are. Something I did not mention was that the MS has significantly affected Ramon's speech. And so it is very difficult for Ramon to even talk. We have calls with him. We can probably make out, every 12th word or something like that. And so it's very difficult for him to be able to advocate for himself. The problem with Ramon's situation is that given his 22-year flat sentence, he is unfortunately not eligible to apply for clemency. If he was eligible to apply, we would take his case to the Board of Executive Clemency and have them, make a decision if he could be safely released in the community. Again, the final decision would rest with the governor, but it would be an avenue for him to seek release based on, this extremely debilitating condition. I am not sure Mr. Ramon or Mr. Stewart's mother, Aurelia, is extremely supportive. The whole family is supportive. They visit Ramon at every chance they can get. As you all know, the Arizona Department of Corrections is not allowing visits right now, which is a good safety measure. So none of us have been able to actually see Rahman. We have been able to have calls with him, which is great. And so before I go any further, I wanted to see if Aurelia Williams, who is Rahman's mother, if she was on the line and if she wanted to chime in.
Katie, she's not on the line yet. I'm still trying to get a hold of her.
Okay, that's fine. That is fine. So, you know, just to sort of sum up here, and then I'm more than happy to answer any other questions. But for somebody like Rahman, like I had mentioned, you know, if he can't get out under these circumstances, I don't know who can. And what can we do to improve procedures so that there is a safety valve, you know, for people to seek release, sort of generally when they have medical conditions, and then also under the circumstances of, you know, this pandemic that we're in. I think there's a number of things that we can do. I think first of all, we can expand our compassionate leave procedures through the Arizona Department of Corrections. It is a policy that is within the Department of Corrections that can be expanded. We can put sort of more resources towards that, come up with a better policy. How are those decisions being made? Who's making those decisions? How can we safely release people who should not be in prison? The other option, as I had mentioned, is legislation. And we have been working on a medical parole bill, which would expand sort of the processes that somebody can take advantage of. So it wouldn't be a clemency procedure where the governor is involved. It would be a parole procedure where the Arizona Board of Executive Clemency would make the decision whether to release somebody. The Arizona Board of Clemency makes these decisions every single day in cases, and they are, you know, they would have the ability to make these decisions. We could expand it to people who are not only within 4 months of death, but possibly within a year of death, to people who are incapacitated, like Rahman, to people who don't necessarily have a prognosis, but they still have a medical condition that renders them incapacitated, and they can be safely released back into the community. That medical parole bill we are hoping to have introduced at the next legislative session, and that is the place where we can hopefully make some real change and real reform. As I had mentioned, Arizona has one of the narrowest policies in the country. There's a lot of data and a lot of research on what this looks like across the country. We can study those procedures, what works, what doesn't work, and we can implement, you know, a very good, a very effective procedure here in Arizona. I think something I failed to mention was that our prison population is huge. It's too big. We need sentencing reform across the board. We need reform as far as these compassionate release procedures go. It's just too big, and we need to start seriously talking about how to reduce our prison population. I think this is a really good place to start with people who have medical conditions and who can be safely released into the community. If you're thinking about ways to help, contact your legislators. Tell them that you're concerned about these things, that you're concerned about individuals in prison, our most vulnerable, one of our most vulnerable communities, and let them know. You know, do some research on what our prison population looks like versus other states, and talk to these people about seriously considering reform here in Arizona. Another way to get involved is, I know Khalil's been doing a lot of sort of raising awareness with the ACLU, with Puente, with Arizona Friends Services Committee and other organizations, the Arizona Faith Network, AACCC, on reentry and reform I think getting involved in those organizations and that is a great way to sort of get involved, learn what's going on here, and be part of making this change. Think at the end of the day, I mean, we are talking about human beings. We're talking about people who are in prison. These people are fathers, their mothers, sisters, brothers, sons, daughters. We have family members who contact us all the time concerned about the well-being of their loved ones. These are human beings, and we need to be able to treat them like human beings and to show compassion, especially those who are most vulnerable, the dying. I mean, show them dignity, sort of at their final days. So that's why we do this work, is because these are human beings and these are people who need our help. And I'm happy to answer any questions.
Khalil, do you want to do Q&A now with Katie or wait till the end?
Let's wait till the end, but there was one question in the chat, Katie, you might want to answer real quick, where you were asked, when you were talking about the legislative side,
Yes.
What organizations or what lawmakers are you working with around the legislation piece? So if you can kind of dig into that part a little bit further.
Sure. I don't know which specific legislators have been approached, but I do know that the ACLU has been working on this issue. I know that the Arizona Attorneys for Criminal Justice, so AACJ, was also working with the ACLU and other groups to try to get something like this, and then the Arizona Justice Project. And so those are the three sort of, there may be more out there that I am not aware of. There probably are. As far as specific legislators though, I don't know who has received this information.
Right.
So if anybody has any ideas that they would like to share, I'm totally open to that.
Okay. Yeah, drop those ideas in the chat box. So real quick, while we have you, Katie, I've been receiving emails from people who are confined. Can we, or this might even be a question for our next presenter, but there was some discussion about them only testing people one time. So we know that people are being tested. If you're positive, they're putting you in isolation, which is another, fear factor. I mean, just to be in isolation and be positive, that increases anxiety. There's a lot of fear, because most people are not wanting to die in prison. However, they're not testing people, or there's reports of not being tested a second time. Once a person is released, it's just like after 14 days, they're putting people out in the general public. Have you heard anything about that?
Good question. I have not. I have heard about individuals being quarantined and how difficult that is, especially if you're very sick. I mean, you're there by yourself. It's very, very scary. And I've talked with clients and people who are very scared of having that happen, and family members of individuals. I have not, personally heard about being tested and then asking for it to be retested. So I am not sure, but if that is an issue, I'm happy to speak with people to see if there's something that can be done. But I have not heard that specifically.
Okay. And what I want to do real quick before our next presenter is we've created, at the ACLU, we've created a video because pre-pandemic, there were still several issues going on with the healthcare system within Arizona prisons. So at that time, the medical provider was a for-profit contracted company. Oh, why am I going blank? Corizon. And, you know, Corizon has a track record nationally for not providing adequate health care at a minimum. And, you know, during my confinement, you would go there. We had people who had chest pains, and they would just give them antacid tablets. You know, we had a really bad experience with Corizon and some of those employees. So, you know, me getting out, I don't own my blessings. Blessings are meant to be shared. So it was an opportunity to use this platform to try to elevate the voices of those who are confined, who are still impacted by decisions from this for-profit healthcare company. So let me see if I can share my screen. I want to play a video. Give me 1 second here. Uh-oh, wrong one. Okay. All right, so here we go. Can everybody see this video?
Khalil, I think you need to share your computer sound.
Okay. Let me stop that.
So when you click share, it should be an option there. A little box. Yeah, go up. Do view options.
Yep.
Yeah, got it.
Okay, hold on. There we go. Sorry, everybody.
Fresh start and a real second chance. Thank you.
Governor Ducey claims that he's giving people like me a second chance.
We're teaching life skills and career skills to inmates.
But under his leadership, the Department of Corrections violated a legal settlement
and failed to give people like us adequate health care while they were in prison.
It resulted in needless suffering
and even death.
Governor Ducey, the consequences of poor health care follow us after we leave prison.
And the results can be deadly.
How can we get a second chance if we're not even healthy?
Real second chances start with good health.
So I bring that point up because, as I said, pre-pandemic, there were several issues going on inside the prison with the healthcare system. However, we kind of stepped over solutions, and people were more focused on reentry and second chances. And this narrative was about second chances. So I was like, well, wait a minute. How do we have a second chance? How does a person have an adequate second chance if they're not even healthy enough to have one? And we really had to dissect that word second chance, because several individuals were released pre-pandemic who were, you know, their second chance or their reentry looked like them having several doctor's appointments and having to get treated for several different things, including hernias. where they were diagnosed while confined. However, they were not provided the treatment. And, this work I do is to really ask our elected officials who are responsible for assisting or providing this health care to those who are incarcerated to really look at what they can do to move away from this punishment state. Department of Corrections was not put together to punish people. Correctional officers are not hired to go to the yard to punish people. That's not their jobs. So people are being denied adequate health care pre-pandemic. Now we get to pandemic, and to still have that mind state that, and these are reports that I get where some of the officers are telling people, well, you should not have committed the crime. Then you don't have to deal with this. And to me that hurts, but it also fuels my passion to keep going, getting up, to keep advocating until we bring change. So pre-pandemic, one of the things I did, based on my experience while I was incarcerated with the healthcare system, I was released. It took me a while to get connected to services. I didn't have insurance. After 15 and a half years, it was hard for me to understand, the documentation. It was really overwhelming. So I went to, somebody, I forget who it was, said, hey, go to Mountain Park Health. I remember walking into Mountain Park and receiving a clipboard. And I was looking at this clipboard. So many questions, created anxiety. And young lady came from behind the counter and offered to assist me. It took me to swallow my pride and get that assistance. And from there, I was able to get services. So it felt like that day, even though I was overwhelmed with the experience of being out and making those adjustments to society, the staff at Mountain Park treated me as family. So I became a Mountain Park patient. It was about like 2013, somewhere up in there. So it was about a year and a half ago, I was contacted and I was asked would I want to participate in some work being done, or how could Mountain Park assist with addressing reentry issues, second chance. So we started we really didn't have a name. We just called it Formerly Incarcerated Work Group. And this is within Mountain Park to address issues of reentry and to eliminate stigmas and fears, stereotypes, not only for staff, but for those being released. Because all of this becomes a barrier to the quality of care. And when Mountain Park said, hey, let's do this, it really shocked me because I had mentioned this to several other medical organizations and they were like, for real. And nothing came to fruition on it. But Mountain Park said, let's try this. So we had a work group, and in this work group, there were several formerly incarcerated people, several family members. It was a luncheon about a year ago. And we talked about several obstacles. We talked about bringing solutions. How can we bring community together implement solutions, especially in Mountain Park. And there were several work groups. And then about the end of last year, I was asked to become a board member of Mountain Park Health. And that really opened my eyes to how much Mountain Park cared about the issue, how much Mountain Park, or how much community means to Mountain Park. And, you know, I really love the work they do. I love how they have a community first. It's not about profits and dollars. It's about community. It's about the quality of health. It's about having healthy community. And as I said earlier, what good is a second chance if you're not healthy enough to have one? You know, when you dissect that, Mountain Park, how do you have community if the community is not healthy? And with that being said, in the first work group, I was able to meet Sarah. And Sarah expressed a deep passion about learning about the criminal justice system, reentry, and things like that. So without further ado, I'm going to turn this over to Sarah and just give her your undivided attention. And thank you, Janie. I see Janie on the line too. Janie Pearl starts with Mountain Park. So thank you, Sarah, for being here today.
Sure. Well, thank you for inviting me. Can you hear me okay?
Yeah.
Okay, good. So I was just asked to explain a little bit about Mountain Park, what we do, who we are, and some of the things that we have done to help with our formerly incarcerated patients. And we actually are working, our project now is, we call it Reach In. It's something that we do along with the insurance companies, so that when an individual is coming out of prison or jail, they are contacted by their insurance company, and we are contacted, and an appointment is set up to have them seen within a certain number of days, specifically for people who are identified as having a chronic illness or a chronic issue that needs attention. So that includes not just things like diabetes and hypertension, from what I understand, but also substance use history, mental health issues, and I think even homelessness is something that is one of those things that identifies them that they need to have an appointment. So at this point, it's interesting you mentioned that that we are on here today, because I just had one of those appointments come through. I'm usually the point of contact first, just to kind of be a gatekeeper to make sure that those patients are being scheduled, not only with one of our medical providers, but as part of their first appointment, they're also seen by a BHC, which is what I am, a behavioral health consultant. So when we're in person, we actually see these patients before the provider goes in. We go in first to talk about them about what to expect from their appointment. We know that a lot of these patients, whether their incarceration has been short or has been long, haven't seen a primary care provider outside of the prison or jail system for some time. So we want to make it as untraumatizing as possible. And we know that for a lot of patients, medical appointments can be very traumatizing. So we ask them some questions, you know, about what their preferences are. You know, we have sliding doors, sliding glass fogged doors at our facilities, and one of the things we noticed pretty early on was that that could be a little bit of a trigger for some people who are coming out of a prison where there may be sliding bars and a sound that goes with them. So we offer our patients that if they would like to, we can close the curtain for their privacy but leave the door open. We talk to them about, you know, when they may need to have that change, but while they're waiting, at the very least, we can do that for them. We ask them about their needs in terms of housing, what they have or what they need. Also, this is just the BHC, any substance use issues that they may have had in the past, whether they're connected with mental health and or substance use treatment now. and some other questions as well. And then when the provider comes in, if there are things that they need, if they need resources for mental health or for substance use treatment, we can be working on getting those referral information while the provider is in the room. We also have some agencies that we work with regarding homelessness that we can connect them with as well. And I often give out just Smart Justice as a resource for those patients to make sure that they're getting connected in that way as well. A little more generally about Mountain Park, we are a nonprofit. We are a federally qualified healthcare center, and one of the things that means is that we don't turn patients away. If a patient has insurance or doesn't have insurance, they can still be seen. We have eligibility coordinators who can meet with a patient and talk to them about what their options are. We do have self-pay we have sliding scale fees, and we can help to get people insurance if they don't already have it. We also most of our offices have more than one, well, we all have more than one service. We have, I think it's 8 offices across the valley now. Most of them are pretty large. Most of them have pediatrics, women's health, and family practice or internal medicine at the very least. We do have 2 smaller offices that only have pediatricians and a BHC, and one of them is based in I'm sorry, that's not even true because they have dental as well. One of them is based in a YMCA and one of them is based in a school. So our other freestanding buildings or other offices have many more services. So I work mainly in the Mountain Park office in Maryvale, where we have women's health, family practice, pediatrics, dental. We have a pharmacy, lab, and I'm thinking I'm missing something. But in addition to those, we also have the behavioral health consultants, registered dietitians, and clinical pharmacists who can see patients at the same time or on the same day that they're in for an appointment. One of the other things about our services, so if a patient walks in and they are self-pay or sliding scale fee and they're seeing their the provider that day, they're not going to get charged for the additional services of BHC or the RD or the clinical pharmacist. If they need it, they're going to get it. We've also recently changed things so that, and if I misspeak on this, I will ask Janie to correct me, but our labs are now included for our sliders. If they are paying a sliding scale fee, most of the labs that they would have done are included in that, so they don't pay an extra fee for their labs that day. We do have a lot of things that we do with the community. Each one of our offices right now is holding food drives. I think once a month in each one of the larger offices, we have a food drive with St. Mary's Food Bank, where at this point it's become a drive-through. You drive up, you tell us the needs of the house, and you get food bags to go. And it rotates which office it's in. So it's in Maryvale once a month, and on another day it's in Baseline once a month, and so forth. Our services, we're a patient-centered medical home, which means that we do have a team approach, and we work with the patient and their family to try to come up with the best health outcomes for the individual. But it's also it's driven by the individual. One of the things that as a BHC that I do is to go into rooms and talk to patients about what they what they feel they can and cannot do for their health at any given time. So you know, I might talk to a diabetic who's having difficulty with their diabetes and doesn't feel like right now they can give up certain foods, but they can manage it in other ways. They're willing to take a different medication. They're willing to check their blood sugars more regularly. So we you know, we've heard it before, but we meet the patient where they are, and then we figure out how to move them a little bit further at a time until they are getting the best outcomes that they can. I'm trying to think what else. Khalil, do you want to prompt me or anything you wanted me to mention that I haven't?
So no, I mean, and that's, you know, I wanted people to understand, you know, when I talk about us being a village and all of us being there together, there are several organizations who do not get credit for the work they do in the community, and the beauty of the new program of reaching in, of recognizing that, you know, those people who may have these serious illnesses, you know, you eliminate a lot of that anxiety when there's a solid next step prior to release, or just identifying it. Can you talk about, in the times of the pandemic, just from your view, I know you're West Valley, you're at the West Valley Clinic, which is Goodyear, correct?
I'm in the Maryvale Clinic most of the time.
Okay. Okay. Just related to the pandemic, just some of the things that you had to make adjustments on, that people should be aware of.
Absolutely. So in Maryvale, we do have a separate well clinic than sick clinic. We're fortunate to have two buildings. So right now, if someone is we are doing triage at the front door. So we take temperatures, ask questions about exposure. And if you are exposed or you have been exposed or having symptoms, we'll send you over to our sick clinic. Otherwise, you'll be brought into the well clinic. We do give masks to any patients who are coming in who don't have masks. All of our staff are wearing masks and face shields at all times while in the clinic. We have moved things around inside of the building so that in our lobby areas, they're more socially distant. We room patients as quickly as possible. But another huge thing we've done is that we have moved a lot of our visits to televisits. So I think it's about 50% of our patients are seen through televisit, so they may not even have to come into the clinic at all. We started just by doing phone, but we're now also doing video. And so it's amazing how many of the things that providers can take care of that they weren't able to do by phone. Rashes and other things that people call about, they can now see those things. They can prescribe medications. And, you know, certainly things like refilling routine medications that you might have to come in for can now be done without having to come in for a visit. And if there is something that's done through a televisit that the provider feels like it's necessary to bring them in, we do have some slots where the providers have discretion to say, I want you to come in on my next day in the clinic, and then they'll make sure that you get in that day so that they can see what's going on in person and do what they need to do. We also, our pharmacy, we have runners now so that we have delivery as well as runners. So you can come to the clinic and you can drive up and let the pharmacy know you're there, and they will bring a prescription out to you rather than you having to come in. We have a delivery service that is working in the Valley, and I think it's certain days of the week you get your medications depending upon if they're coming from Maryvale, it will be certain days. If they're coming from Baseline, it's other days, but you can have your medications delivered to you rather than even having to come into the clinic. And the other thing I forgot, so we also do provide transportation for our patients. We have contracts with companies where if a patient has difficulty getting to our clinic, we will provide transportation for them. Or if we refer them someplace else for an appointment, like a specialist, a cardiologist, we can also help to get them to those appointments so that that's not a barrier for their care.
Okay. And as far as testing, you know, what are your testing hours looking like, testing locations? And can you kind of give the audience a quick glimpse of how many people Mountain Park has tested? Because I know there's been, from day one, I know Mountain Park was really making these tests available and really being out there in the community, and thank a lot of those frontline workers who were you know, being out there also from day one.
Yeah, that's how many tests we've given. I don't know how many we've given off the top of my head, and maybe if somebody else has that information, that would be awesome. But I do know that